Hello, welcome to Wellness Wednesday. I am Laurel Brennan, and we are inside the Facebook group Brain Wellness and Dementia Prevention. And I am here with Latha Naganna Fray, and I am thrilled to have you here. Welcome, Latha.
Hi, how are you?
Good. How are you?
I'm good. Excited to see you and chat with you and help answer questions.
So thank you to your mother and mother-in-law who are holding down the fort at your end. So you can step away from your extremely busy life. So thank you for your time. We'll try not to keep you too long. I want to give everybody just a quick background on how Latha and I know each other and her bio, and then we'll jump right in. So actually, Latha knows me as Laurie because anyone before 1991, that's what I was called. So we knew each other in high school, played lacrosse together, and then Latha went away to grad school, or to college and grad school. Let me give you a little bit more about Latha. So she grew up in Westminster, Maryland. So that's how we know each other. And her parents, let me make sure I say your dad's name right. Is it Dr. Chitrachedu?
Chitrachedu, that was close.
And her mom, Vimala Naganna, both doctors. They immigrated from India in 1969 and settled down in Westminster and started a combined cardiology and primary care medical practice. Latha went to McDonough School and then Westminster High School, where she played field hockey and lacrosse. And then she went to Duke University for college and graduated with a BS in biology and a BA in environmental science. I have a question about this next part. After graduating a year early, she traveled across the country and lived in Tucson, Arizona for a year until she started medical school at Tulane Medical School the following year, completed her MD and an MPH in health administration. She did her internal medicine residency back at Duke and a cardiology fellowship at the University of Maryland. Then she returned to Westminster and joined her father's cardiology practice in 2005 in Westminster and is married with two beautiful daughters. She is a board certified in general cardiology, nuclear cardiology, and internal medicine. She was previously the medical director of the Cardiovascular Steering Committee at Carroll Hospital Center and served as the chief of cardiology for many years. Did I say she has two daughters? So those are on pause, those chief of cardiology at the moment. So your girls are what age?
2 years and 7 months.
How you're doing it.
It's been fun. They're just, they're growing and changing and keeping us on our toes for sure. So
yeah. So I have to know, how did you get 2 degrees and graduate a year early? I hope you went to Arizona and relaxed for a year, but I bet you didn't.
It was sort of like it just all came together because I don't know if you remember in high school, I actually went to Western Maryland College, now McDaniel College, and
I didn't remember that.
Yeah, so I had done some college classes there, and so when I went to college, I had already had some credits, and then we went to Beaufort, North Carolina, did some summer credits, and whatever it was, it just worked out that at the end of 3 years, I was, okay to graduate. And I was like, well, I'm not going to go to med school right now. I'm going to take a year off. So I drove cross country with some friends and went to Arizona. And one of our friends, Teresa Skur, lived out there.
Yeah.
So with her. And so, yeah, I just stayed there and I did some random, jobs. Like I worked as a waitress and did some research and, just did some random things and then went to med school after that. So
that's good.
Adventurous year.
That's awesome. I'm glad you got a gap year after all of that hard hitting the books and then many more years of hard hitting the books. So good for you. So beyond what I've already read in the little bio, from your perspective, what was your journey? I mean, did you know when you were 5 years old that you wanted to be a doctor? I mean, both your parents were doctors, so maybe that was an early expectation. Or so from your...
I remember telling my parents I wanted to be a teacher and then I wanted to be a dolphin trainer. Those were my big dreams as a kid. And then I guess it just, math, science, that was what I was good at really. And of course my parents were an influence. They kind of never pushed us in any specific direction, but I really loved cardiology after I knew more and more about it. And it just sort of seemed like a natural thing to follow my family's footsteps. So I ended up in med school. So long journey, but well worth it.
Yeah. Well, I was excited for you, back then, and I'm excited for you now and following your career. And we're glad you came back to Westminster because you could have gone anywhere.
Yeah, no, that's been fun because I see a lot of people I know, and just being in the community where we all grew up together and see everyone. It's been really nice.
Yeah. Okay, you ready to jump into the meat?
Sure.
So, because this is a kind of a brain health group, but last month was our heart month, and I want to see if we can tie those two together. Obviously, heart health is your area of expertise, so if we can just jump into cardiovascular disease in the United States, is it a big problem or a little problem?
It is the number one problem. So yeah, I mean, just the statistics are pretty staggering, but heart disease, and we call it cardiovascular disease, which includes heart disease, heart failure, stroke, all adds up to be the number one leading cause of death. The good news is over time, we have been able to actually make a dent in some of those numbers with some of the medications, some of the treatments, prevention, diagnosis. The numbers have come down over the last several decades. So that is one really nice thing about being a cardiologist is I feel like we've been able to have a huge impact and really reduce the risk of death from heart attack, stroke, all those different things.
Right. So from my perspective, not a doctor, an occupational therapist, health coach. So are there things that I can help people with that people can do on their own from a lifestyle perspective that can reduce their risk of heart disease?
Well, yes. And, heart disease and brain disease, which I guess I refer to as stroke or, damage that can happen to the brain over time, they all are tied together. And so things that help reduce the risk of heart attack also help reduce the risk of stroke. But a lot of it is healthy lifestyle, which would include not smoking, which is a huge one. That is a huge risk factor for developing not just heart disease, but vascular disease, meaning blockages in the aorta, in the legs, in the carotid arteries, and in the brain. So the entire body is affected by smoking. Diabetes is another big one, which sometimes it's genetic or there's certain factors that can't be controlled, but watching diet as far as carbohydrates and fats and trying to eat healthy is a huge one. Difficult for a lot of people to change their lifestyles, but that has a huge long-term impact on all of those things. And then exercising, the recommendations, on paper are to try to do 30 to 60 minutes a day, 5 days a week, which is unrealistic for a lot of people. So we usually try to get patients or people to do whatever activity they can, even if it's 10 or 15 minutes at a time in the morning or in the evening or in between something, just try to get some kind of activity where you get your heart rate up and you feel like you're, getting your body moving has a huge impact on reducing risk. And I think it also helps with stress and anxiety and other things that play a big role in general health. And getting checked for high cholesterol, for high blood pressure. Those are things that can be treated. And if you catch them early enough, can really reduce the risk of the effects on the kidney, on the heart, on the brain, because the whole body works together and all these things have kind of microscopic impacts over the years. And so getting ahead of it has a huge benefit.
Right. And visiting your doctor to find those things out, because for most people, high blood pressure has no symptoms, high cholesterol has no symptoms, diabetes has no symptoms. So going to see your doctor to get those levels checked.
Yeah, so I think the biggest gap is men, right? Because men might go to their doctor maybe when they're going to college and they have to do some kind of physical for sports or something like that, but they really don't have to go to the doctor for anything for years. So that's, I think, a problem because sometimes we don't see them until they're 40 or 50, and maybe they've been having some issues that could have been caught by routine blood work or just checking a blood pressure. Women usually go to at least a gynecologist or have a doctor that they see more routinely. So sometimes there's a better opportunity there to get routine blood work and blood pressure checked. But just those basic things, getting lab work to check your cholesterol, to check your kidney function, to have your blood pressure checked, can already identify several risk factors which are treatable.
Yeah, I hadn't even thought about that for the men, but now that you mention it, my husband doesn't go to the doctor very often.
And they don't want to go, and even when they know they're supposed to go to.
Yeah. And I'm going to circle back to your exercise comment. So they say now that sitting is the new smoking. And with so many people working from home the last couple of years, there's lots and lots of more sitting in front of, screens like we're doing right now. And so I just want to put that out there, encourage people. On a call today, the person I was talking with, she got on the treadmill, and the call that I was on this afternoon, I did it while walking the dog. So just adding in little bits of activity during your day can be super helpful. I teach yoga as well, and a lot of people will say, oh, I can't do that. I'm not flexible, or I'm overweight or something. But that's my favorite person to work with. Yoga is for everybody and everybody.
Yes, and I think it's one, I guess the good and bad about computers is that it might make you sit more, but then there's also access, I feel like, to exercise programs and yoga, or just something you can do at home and not have to actually get up and go somewhere.
Right.
So it's more accessible, just people have to get motivated and do it.
Right. So the top things: move your body, eat well, go see your doctor, minimize stress. So when should we go see a cardiologist? So say we have a primary care physician, our blood pressure is good. When do we need to go see you?
That's going to probably depend on a lot of, individual factors. But if the one thing is, if there is strong family history of early heart disease, then those people really should probably see a cardiologist sooner than later. And it doesn't have to be a cardiologist. I think there's some primary care doctors that may be proactive and do certain things. But once you've had blood pressure, blood work, and all those things done, there's another test that I try to do on patients that are higher risk based on their family history, and it's something called a calcium score test. So it's a very low risk 10-minute CAT scan that can be done at advanced radiology or any general radiology place that will give you a number of how much plaque buildup you have. So if there is someone who had a family member that died of a heart attack in their 40s or 50s, maybe when they're in their 30s or 40s, when there's potentially plaque building up, if we do a scan, we can start seeing if there's a problem. There's no specific age, I would say, but at least having that opportunity to get the test done, I know we definitely identify patients that we never would have thought of were higher risk. And then we are more aggressive with cholesterol medication, with blood pressure medicine, with stress testing, with following them a lot more closely to watch the progression if there is actually disease. So probably, I think if you have risk factors like family history of diabetes, family history of heart disease, heart failure, seeing a cardiologist at least to get maybe a checkup in your 40s to 50s potentially, or talking to your primary care doctor about getting a screening test if it's appropriate.
Okay, I'm glad you mentioned that a CAT scan, the calcium score, you called it, because I was not familiar with that. I assumed that tests were invasive. They're going to go in and stick wires in you. So that's a non-invasive test that you can get lots of information from, and I was unfamiliar with that.
Yeah, so it used to be something you could get an order from, or I think patients were even able before to get it, just go in and pay $50 and get it done. It was a relatively inexpensive test.
Wow.
Insurance companies are now, of course, getting in the middle and make us do some assessment of risk. But even if it's not covered and a patient wants to get it done, I think you can still get it done for a low cost, for approximately $100 if the insurance company won't pay for it. I think it's very valuable because, if it's zero, then we know that you're low risk and may not be worried every time you have symptoms or worried about something. Or if we find something, then we didn't miss the chance to treat it. So it's something that either primary care doctors can order, or if a patient wants to see a cardiologist, they probably could see if they think they're at risk or they want to know.
Right. So since we're on the topic of family history, if there's been a family history of heart disease, stroke. Since 23andMe came out, it's become more popular, more common for people to know some of their genetic background as well. You can pay a little bit more from the 23andMe to get the full breakdown of your code. And an ApoE4 gene can increase your risk of heart disease and also Alzheimer's. So I learned about this from my own genetic testing, and we didn't have anyone in the family that had dementia prior to my mom. Many people lived into their 90s. And once I found out this information about the ApoE4, then I started thinking, oh, yeah, my mom's dad and my mom's brother and my mom's cousin and another cousin and an uncle all died in their 50s from a heart attack. So probably they were ApoE4 positive. So can you talk about what ApoE4 is and its connection to the role that it plays in our heart health and potentially brain health?
Yeah, well, ApoE4, or there's several different genetic alleles, I guess, or patterns of that. And so it has to do with cholesterol metabolism. So it can affect how cholesterol is carried and how it binds to things in your body. And then it significantly can increase how plaque builds up. So that is coronary disease, plaque building up and getting stuck inside the artery and then eventually blocking the blood flow. So and I'm not the genetic expert on these familial diseases, but in general, we know that if you have one of these familial patterns, the cholesterol can be very high, can be very difficult to treat sometimes, but there is also just a very high risk of having plaque buildup and then cardiac events happen, unfortunately. So we don't normally test for it. And I think one of the problems with genetics is that you can have the genes and you may identify that you carry the gene, but you may not necessarily express the gene. Like your family history, I don't know all the details, but there's obviously some increased risk for cardiovascular disease, and whether it's all from ApoE or from something else, having that increased risk is definitely worth knowing about and should hopefully help motivate you or whoever is involved to try to do everything you can to reduce the risk, treat the cholesterol, do all the things that would help reduce the risk of an event.
Right. Yeah, you mentioned the gene and whether not everybody wants to know, and but there's also the fact that genes can be turned on or off based on the epigenetics, the environmental influence. So I don't know if you want to explain any more about that. What is epigenetics? And
well, yeah, it's just like I was saying, like if you have the gene, it doesn't necessarily mean you're going to express it, right? So it's like the phenotype of the gene. Like, are you going to actually, like if that is a gene that says you're going to have blue eyes, you may not have blue eyes, right? You may have a different color eyes just because the gene may not actually express itself in your body the same way as someone else who has that same gene. And that's the $1 million question, is what causes that gene to be expressed in each individual person. So I wish I knew the answer, but obviously if you carry the gene for something that you don't want to have, how do we make sure that it's not expressed? And understanding all those environmental factors is very challenging, very difficult, because every individual lives a very individual life. And how do we know if it was the smoking, if it was, what they ate, if it was that they didn't exercise, or what was the reason, or, where they lived. So it's, that's why I think genetics, as we go forward, having more of this DNA data from all the people that are probably now signing up for 23andMe and things like that, they're going to have so much more information and really be able to understand by then connecting with people and saying, hey, you have this gene. Do you actually have this disease? Do you have this problem? And then probably based on that, try to piece together, how do we figure out what is causing this or what is preventing this?
right. Yeah, we do in preliminary studies, we know that, all the things that we mentioned, the eating well, the not smoking, the exercising, the minimizing stress is more likely to reduce the chance that ApoE4 is going to be problematic. So let's move on to nitric oxide. So this, people are going to hear nitric oxide and they're like, you mean when you go to the dentist and you like breathe, breathe nitrous? But if you can explain nitric oxide and its role in heart and brain health for us.
Yeah, so nitric oxide, I guess in general, is a vasodilator, so it helps keep the arteries open. It helps lower blood pressure, probably helps with immune system health, and it's sort of like its benefit is systemic, right? It helps every part of your body. And the key is, how do we increase nitric oxide in our bodies, which I think is, again, a huge challenge, something that we would like to have the answer for. But it always still comes back to the things you were saying, that eating healthy, exercising, not smoking, all those things probably help release more nitric oxide in our bodies, or help give us the right substrates to be able to produce it. So that's where I think a lot of research is also being done.
Yeah. It's my understanding that greens, eating leafy greens, really increases nitric oxide. So
that darn spinach is
your kale, your collards, your bok choy, eat them up every day.
Yeah.
And we're going to jump to the next question. Thank you for that one. Since we're also in Women's History Month, you're our good segue from Heart Month to women. I had a dear friend die from probably from a myocardial infarction last September of 2020, and she didn't see it as being a heart attack. I think she had two, in hindsight. So if you could share the implications that women have not been studied as much, and for the reasons that you mentioned, because they have babies, and so they're not as good of test subjects because our hormones fluctuate. So they study men instead. But how did that impact women and heart health? What we know.
Well, I think the good thing is now there are definitely more women in cardiology, and there's a lot more women that are focused on finding, disease process and pathology, which is different sometimes in women. But yes, women have, in general, the symptoms are the classic symptoms of chest pressure, chest pain, shortness of breath, feeling like you can't do your normal routine because you're like, oh, I feel tight in my chest. I can't breathe. So those are still the classic symptoms for both men and women. There is just sometimes when women may present with just, I feel kind of tired. I don't feel like I can do what I normally do, or maybe more gastrointestinal kind of symptoms like nausea, or, I'm just, I feel exhausted. And I think women are usually also caregivers, so they don't always pay attention to their symptoms, and they're so busy doing things. They're like, oh, I'm fine. I don't need to get tested. So I think that's also a problem, is sometimes by the time they come in, they've had symptoms for a long time, and they haven't, it hasn't been diagnosed earlier on. But heart disease for women is slightly lower until we hit menopause. And that's why in the past they did studies on hormones, thinking, oh, well, maybe it's now that the hormones are changing. If we give back those hormones, maybe that would reduce the cardiac risk. But those studies didn't pan out. So the thought was after menopause, giving hormones, but that actually showed a slight increase in heart disease risk. So we try right now to give women hormones if they need it for any kind of postmenopausal symptoms, but it's not meant to reduce the risk of heart disease. And then just in general, like, women still need to do all of these things, like get tested, get screened, have their blood pressure checked, have it followed. And we are trying to do more and more studies, but there are studies that have shown that women have smaller vessels and they have different types of disease. So they may not have the isolated blockage that can just be treated with a stent. And we see that a lot with diabetic patients too sometimes. And actually in India, there's a lot of diffuse heart disease. So it's a little bit harder to treat. It affects the whole vessel and the tinier vessels within the heart muscle. That is sometimes harder to diagnose, and maybe why there is some slightly different presentations. But again, it still has to be treated and diagnosed the same way with the information that we currently have.
That's interesting. I like to play around and watch TED Talks, and I saw a recent TED Talk. It was originally done in 2019, and Sandeep Johar was the presenter. He's a cardiologist, and he talked about how the emotions, so fear, stress, grief, can actually physically change the shape of the heart. Like there's a physical shift. And can you talk about that? It has a name. What is that called?
Yes, I think he was talking about Takotsubo cardiomyopathy, which that word Takotsubo, the shape is a Japanese word for vase. So it has to do with how on an echocardiogram the heart is usually shaped like a football, and when a patient has this type of cardiomyopathy, the top part of the heart squeezes better and the bottom part doesn't. So it kind of is pinched at the top and looks like a vase. That's where the
Mm.
name came from. But it's a very interesting phenomenon that was diagnosed probably within the past, couple of decades, as far as something that can actually happen. Um, but it is felt to be related to significant emotional stress, or some type of event, which then triggers hormones that cause spasm of the coronary arteries. Potentially, then clotting can happen, and it acts like a heart attack. So a patient will come in saying they're having chest pain. The EKG will look like a heart attack. The troponins, or the numbers that are suggesting injury, are elevated. And then they might have a cardiac catheterization to look at the arteries, and the arteries may be completely normal. And then the echo, the ultrasound to look at the heart function, will show that pattern. And usually, after all those steps have been taken, they get some medicines usually to help the heart heal, the heart function will actually get better. But it's thought that this acute stress type of event causes the hormones in this acute spasm to happen.
Right. So this is just another link, the brain connection to the heart. So in January, we did a whole month of mindset, and one of our guests talked about, what we believe and think leads to our emotions, which leads to our physiological changes in our body. This is just a very dramatic example of that.
Yeah.
Yeah.
It's it's I've had several patients that have had an acute event of some kind, have had this happen, and they usually recover. But yeah, it is interesting that you see an actual change in the heart function and actual injury happen to the heart, related to an emotional stress event.
Yeah. In the TED Talk, he also talked about a study with rabbits, and they were giving them a high cholesterol diet. I don't know if you know about this study. And some of the rabbits had blockages and some didn't. And they were kind of scratching their head. Well, some of the rabbits we like play with and talk to more. So could that be it? So then they designed the study on purpose and fed them the same diet. Some rabbits stayed in their cage. They were never touched or talked to. And other rabbits were brought out and pet and loved and cared for and talked to. And at the end of the year, they did autopsy, and they saw that despite similar cholesterol levels and blood pressure and heart rate, the rabbits that were held and played with and talked to had 60% less aortic disease.
Wow, that's interesting.
I know. So go hug your children now. It's good for your heart.
Lots of hugging and talking.
Lots of hugging and talking too. It's a decreased stress. It's good for the heart.
Yeah, no, that's fascinating.
Yeah. Is there anything else that you want to add before we wrap up tonight?
No, I think it's always a challenge because we kind of know certain things that increase risk and things that lower risk, and it's always how to get people to try to implement in their own life, because life is stressful and there's always so much going on. There's kids, there's families, there's work, there's COVID. I mean, it's been a really hard couple of years for everyone. But I do feel that when you eat better and you exercise, that you then end up having your body has more of the right things it needs to take care of itself. So mentally, emotionally, all of those things play a role. And it just, if we had a better, way to get people in a pattern of, wake up and maybe try to spend 10 minutes walking, then eat a healthy breakfast and get your day started. I think it helps you get your brain on track. It helps with anxiety. And just when you eat better things, you don't feel, and that's an actual physiologic thing. We know when you eat things that are high in fat and high in carbs, it actually makes you want to kind of shut down and sit down and let your food digest versus if you eat, healthier things. So I wish I had more time in my day with my patients, but having nutritionists or people that can help get people on the right track is one of my challenges. But I always try to encourage people to do those things because I think it helps for the long run.
Right. Usually at the end of these interviews, I ask people to share how people can find them on social media, but you have a really busy life. You might not want people to find you. Like, go find some cardiologist somewhere if you need. Don't come see you because you're
not
full.
trying to tell people how old we are, but I think all of our age group people now are getting into that point where they need to start coming in and getting their blood pressure checked and cholesterol checked and get on the right path. But I'm still working full time, by the way, which has been a challenge but fun.
Wow.
And my husband's awesome and helps, and my mother-in-law and my mom, and everyone's been very helpful. So, but I'm in Westminster. I'm right down the street from our high school and from my old house. So yeah, I'm right in town.
Okay. But sure. People can do you want to share your information or no?
If they want to look up my website, which I'm always working on in my free time, it's www.carolheartcenter.com. And it has some more just contact information if they want to come in and chat.
Okay, awesome. Thank you so much for your time tonight. I know you're busy and I really appreciate your time.
All right, well, great seeing you.
Great to see you. Go hug your babies.
All right.
And your mother-in-law and mother and husband. Big group hug. All right.
Take care, Laura. See you soon.
Bye.